50 years ago, President Lyndon Johnson signed into law the Civil Rights Act of 1964. This was a landmark and pivotal piece of legislation that outlawed discrimination based on race, color, religion, sex, or national origin. The Civil Rights Act markedly changed the course of U.S. history and led to major changes in our society. Many Minnesotans were involved in passing the Civil Rights Act and in many of the civil rights-related events that preceded and followed its passage. In honor of its 50th anniversary and the impact it has had on the overall health of U.S. society, we'll be celebrating and talking about the 1964 Civil Rights Act on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today, about 50 years after its passage, we are going to talk about the Civil Rights Act of 1964. We will discuss how the act came to be and how it has altered our world. We'll also be noting that much work remains in creating an equitable society for everyone within our country. Joining me in that discussion are two distinguished guests who can add unique perspectives to the Civil Rights Act. The first is Josie Johnson, an educator, activist, and an administrator. In numerous ways since childhood, Josie has played an active role in advocating for the civil rights of disadvantaged populations. In the 1960s, she served as the acting director of the Minneapolis Urban League, and in 1971 became the first African American to serve as a regent on the University of Minnesota's Board of Regents. Subsequently, she became a member of the University of Minnesota faculty and served as Associate Vice President for Academic Affairs. Josie has received numerous awards for her work, and in 1997, the University of Minnesota created the Josie R. Johnson Human Rights and Social Justice Award. Also joining us is Scott Gray, President and CEO of the Minneapolis Urban League, an organization that was founded in 1926 to link African Americans and other people of color to opportunities that result in economic success and prosperity. The Urban League is a tireless advocate for policies that reduce racial disparities. Welcome to both of you.
Thank you.
And it's really an honor to have you on the show, talking about what I think has been a really pivotal part in our U.S. history. And certainly I was in high school during this, when the Civil Rights Act was passed and the Voting Rights Act was passed, and it was influential in my going into healthcare with all of the stuff going on around that. So I want to, chat about that.
Sure.
Its impact, how it got started, and its implications for today. And Josie, I want to start with you. At the time, right now, we're celebrating 50 years of the Civil Rights Act and the Voting Rights Act,
right,
and 60 years of Brown versus Board of Education, right, which also changed education.
Exactly.
Looking back now 50, 60 years, how did that all come about at that time? What happened during that period of time in our U.S. history that brought all of these things together?
Well, I think you have to go back before all of that happened and was taking place in our country, because the system was so carefully set to deny us any rights at all and to try to overturn the Emancipation Proclamation. So you have to create an environment in which much of this was happening in front of us, and where Black people and many other people of color as well were denied any rights. So when we talk about civil rights and voter rights, you almost have to go back to where our people were before that. Mm-hmm. And the Brown decision is clearly one that we need to remember and understand the rationale for it and why it appeared to be an important piece of constitutional law in order for us, and perhaps you as well, to get through your academic planning. Mm-hmm. When I think about the Brown decision and realize that in part of my research for my doctoral degree dealt with what Black families and Black community did to educate our children from 1865 to 1954. So we had that whole environmental period that talked about fighting for education. And the fact that today, even though we have the Brown decision theoretically in place, there are very few people who know the history of African American people and their struggle for education and their belief in education and their willingness to suffer and die for education, because the system doesn't know our history. Mm-hmm. And therefore, the images that they present to our children in schools, in communities, everywhere we gather, it gives the impression that we as a people are not interested in education. Mm-hmm. So we have a lot of work to do there in educating those who educate our children. Mm-hmm. When the Brown decision was determined, and it had a little bit of a struggle, because the Supreme Court, some of them weren't quite sure in '52 and then in '54. But what I think we did here in Minnesota in '70 to early '70s, as far as education is concerned, was to have our Supreme Court rule that we too were a segregated school system. Housing was a part of that. So the idea of community schools was linked to residential populations. In the early '60s, we, the Human Rights Department, the League of Women Voters, the Urban League, and others were very interested in trying to change the policy of housing in Minnesota. And we did some testing of that. I had African American people apply, white people apply with the same profile, and then to see how the real estate industry responded to that. So working on that, I was chief lobbyist for fair housing in early '60. We actually Minnesota passed fair housing law before the federal government. The federal government did in '68, we passed ours in '62. So the idea was then to create an equal education opportunity for Minnesota children, and to try to figure out how to avoid the geographic restrictions so that education and housing and health and all the other issues could be addressed. Mm-hmm. Now, I may have gone beyond what you asked, so pull me back if
Well, I want to expand. We're going to take a little break here in just a second, but I want to, what you've done is sort of lay the groundwork, and I will come back after our break to ask Scott, how does the educational piece, how does it reflect today? Because you didn't live through the same period, and how we're using that educational piece today and with some of the same issues that we have today. Sure. But first, we need to take this little break. Sure. We'll be back right after this message.
Today, 1 out of every 4 American kids is Hispanic. That means many of the future doctors who will care for us, the engineers who will build our cities, the scientists and entrepreneurs of our country can be your kids. We all know how hard it is for you to send them to college. This is why we want you to know you are not alone. And every day more people support you to make it happen. Many support you. And the Hispanic Scholarship Fund helps you prepare, plan, and pay for your kids' college education. HSF.net.
Welcome back. We're talking about the Civil Rights Act, the Voting Rights Act, and the Brown versus Board of Education, which we're celebrating the 50th and 60th anniversaries at this point in time. We're talking with Josie Johnson, a civil rights activist, among other things, and Scott Gray, who's president and CEO of the Minneapolis Urban League. Scott, Josie talked about that educational piece was so important in learning about the African American history about education. Now you're a younger guy now running an organization that really focuses on the needs of populations of color. what kind of education needs to happen with today's community, not just in schooling, but education broadly about the issues, and what are you learning from this conversation and what happened back 50, 60 years ago?
Sure. Well, anytime I'm in the room with Dr. Johnson, I'm always like a sponge because she has just a certain wit and humbleness about her and laying kind of the groundwork. And I think just a little modest about all the groundwork that she and her colleagues have done over the past years to make sure that we're in a better place. A lot of our families now that are engaged in the education system, a lot of us might not know all the struggle just because we're 50 years removed. But I think a lot of our families are seeing the struggle because the institutions have not been really supportive of kids of color. We've seen numbers that are almost are in academic proportion to some of the challenges that we have in our community. It's almost an epidemic out there. We're seeing our black students in particular not with one of the largest disparity gaps in this community, where we see this community as a highly educated community, things that are, is looked at across the country as one of the best places to live, but people of color are not part of that dream. And so I think the opportunity for us is to really start to go back and use folks like Dr. Johnson as a passageway to the past and trying to understand how we got here, but also a key to unlocking the future, that we need to come together as a community. And at the movement, in that time, it wasn't just African Americans. There were a number of Americans that rallied around the movement to make sure that there were equal rights and fair treatment for people of color. And I think we need to have that same movement. We're seeing that now in kind of the Black Lives Matter movement, which is good, but it's kind of a result of what has happened in our communities that we've seen over the years. What happened in Ferguson, what happened in New York and Cleveland have brought young folks out. But we need to start to take that momentum and continue to build this new foundation and this place to where we need to see solutions happening for our families, for our kids, for our community, because this just, to me, America isn't a better place unless everybody has the equal opportunity and to succeed.
Yeah, well, you bring up this real paradox. We have major disparities in our country. In Minnesota, it was one leading the pack.
Sure.
Did the Civil Rights Act, did the Voting Rights Act actually make a difference? We're looking 50 years now, where we are and where we would like to be.
Right. In order to answer that, I'd like very much to just remind us of something that created the environment that we're in. You'll have to remember that my ancestors were in slavery, and an attitude had to be developed, in my judgment, for the slave owners to maintain the cruelty and the treatment of my ancestors, right? So they had to say to themselves they were doing the right thing and that we are an inferior people. They had to convince themselves of that in order to treat us the way they did, because I maintain you'll go crazy if you abuse people and know you're abusing them. So laws, policies, attitude, disposition, all of that, in my judgment, is etched in the fabric of American life. So even though in the 50s and the 60s, we were fighting for equal justice and equal rights, what you had to do in that period was to address the laws that denied us. But we couldn't address the hearts or the minds that really continued to live the reality of the supremacists in our society. So, whereas we have now in Minnesota, this is Minnesota, the highest academic gap of any state, which at one time was just not the case. What we find is that there is, I believe, a group of young people who know something is wrong. They just don't know what. They don't know how to address it. And we have created an environment of protest. And sometimes we're protesting, and then we're not able to figure out exactly what we're protesting, or we create the protest and include so many other segments. So the passage by the rule of the Supreme Court with the Brown decision, there were many who thought that was the answer. And then the fair housing and the jobs opportunity, equal employment, all of those were policies that the community fought to eliminate. So when you work at eliminating the policies, the rules, the ways of knowledgeable denial, then you find that it's what we said in the 60s, that unless you change the heart and mind, then people will find ways to redo what the laws had restricted. So it's, when you think about all the things, I maintain that right now, because the laws have been eliminated, the laws, the attitudes haven't. And people were trained to think of us as less than. I look at the way, the inability on the part of the majority now to accept the fact that we may have a model that doesn't meet their image of who we are.
And
Therefore,
and I want to talk about a little bit what changes need to happen in the last segment, but I need to take a little break for right now. So we'll come right back to this, so hang on to that.
All right.
We'll be back right after this message.
I come from a big family. I'm the oldest of 6. To me, being the first person to go to college, it's like setting a standard, you know? My little brother is 8 years old now. I challenge his curiosity. I challenge him to dream. I have to paint a picture for him that he can look up to and live up to and possibly be better than. My name is Jaquez, and I am your dividend.
Welcome back. We're talking about the Civil Rights Act of 1964 with Josie Johnson and Scott Gray. Josie, you mentioned that the civil rights, all of the legislation back in the 60s and 50s changed the laws, but we didn't change the heart. And I think, you know, we now have the disparities. And we also have a markedly more diverse society than we had in the 50s and 60s. We have people from all over the world, people of color, American Indians, and coming together. How do we build that consensus again to change the heart so that we actually, you know, make life equitable for everybody? Because we all benefit. You know, the data are showing that when we have equality, when we have equity, everybody benefits, even those at the top, not just those at the bottom. What do we need to do? You know, we only have a few minutes left to talk about. Scott, where would you start on what do we need to do?
Well, I think that we need to think about a new movement that is building on the legacy of Dr. Johnson and her colleagues. That is, this is a new community, folks that are new immigrants, but poverty is the same in a number of different communities. And so we need to rally around what's important for our communities: education, housing, jobs. And we need to come up with a strategy that is really about making sure that we follow these things from advocating them to the end. And so the policies are there, but the institutions in some ways are continuing to act the same. And as Josie said, that, you know, the heart may not be following the law. And so I would suspect that this power base will continue to grow and folks are not, we're seeing this kind of abandoned population getting bigger in our communities. And they, at some point, will need to use their political power, right, to go and make sure that things are being advocated for them and that solutions are starting to happen. I think we're starting to see that through the Black Lives Matter movement, but again, we need to tie those to organizations like the Urban League and NAACP and La Raza and all these organizations that are fighting for people of color, and making sure that we have one strategy around each of those core areas that it takes to move a family from poverty to self-supporting, to be self-supportive or economic self-sufficiency. We need to continue that fight and to keep pushing on our institutions to make sure that they're treating everybody equal and fair, and that we are starting to see folks at the end of the day move out of poverty.
Well, I know back in the 50s and 60s, we had some leaders in the white community. We had Mondale and Hubert Humphrey,
and Don Fraser,
and
Art Naftalin,
and even William Douglas on the Supreme Court,
right.
and multiple African-American leaders. Do we have the same kind of leadership today? Are there people who are saying, you know, we need to continue this fight, we really do need to advocate for some major changes?
I'm sure we do, and they're out there. We see them, we hear them, we know them by name. What I believe, in order to try to do what Scott has just described for us, is something we don't do well, and that's talk to each other. To have an understanding as you do, Commissioner, with your program, we need to have communities get together to create a sense of trust and language, so that we understand what we need to do collectively and why we haven't accomplished it. Because I think what I'm observing at my age of 84 is that we seem to be repeating the history that my ancestors and my generation of people fought for. We truly believed, as William O. Douglas believed, that the Supreme Court, in its declaration of what is right and just, and he fought for that throughout his professional and private life. We don't talk about that. We sort of jump over why we feel the way we do. Why does America have this sense that there are certain people who are just not deserving, or that it takes too much energy, or we have to stop, in my view, doing what we continue to do. We take on movements, we gather people, we nod, we support, we salute, and then because of how we've been trained, and I maintain it's in the fabric of American life, you return to business as usual. We don't do, I believe, enough assessment. What were the goals? How did we design a strategy for accomplishing the goal or meeting the mission, or what were the end results?
Dr. John, I think too, you know, we as a people of color need to have some accountability ourselves as well. And I hear you saying that. I think we also need to have a report card for the institutions that serve us as well. And those things need to match up at the end of the day, that we're aligned in the same strategy moving forward, and that the end results, the strategy may be a little bit different, but the end results have to be people are getting the opportunities that they deserve to get. And so I think in the movement with you and others, there was a lot more of a collaborative spirit around we need to make sure housing is there, we need to make sure education is there, and somehow we've got away from that spirit into more of an individualistic spirit.
Well, I think part of it is what we know is if you've got a goal and it's written out there that right now the issue is housing, whatever it is, then you can coalesce, you can work around that because you see it. It's in writing, it's in practice. For example,
well, I'm going to have to stop you. You're teeing up the next conversation we're going to have, but we've run out of time. I mean, this is, like I said, goes very quickly, and there's lots to talk about, and you've raised lots of issues and have really framed things really nicely. We need to have another conversation.
Absolutely.
So thanks for being with us.
we're happy to do it. Thank you for inviting us.
I'll be back with a closing comment right after this message.
What if you could invest in the future of kids, like a stock? Not the kind of stock that's about making money, but a stock for social change. A whole new kind of investment called Better Futures. When you invest, it helps kids go to college. Believe in us, invest in us, watch us grow.
My name is Sydney, and I'm your dividend.
British industrialist Geoffrey Vickers defined public health in this way, quote, "The landmarks of political, economic, and social history are the moments when some condition passed from the category of the given into the category of the intolerable. The history of public health might well be written as a record of successive redefinings of the unacceptable." Close quote. What's striking in that definition of public health is that Vickers didn't mention disease prevention and control or the environment. He didn't talk about physical or mental health conditions. Instead, he listed the continuous action on political, economic, and social conditions as the defining characteristic of public health. We've declared infectious diseases intolerable and made them unacceptable. We are making progress in making tobacco use unacceptable. I'm sure obesity, alcohol abuse, physical inactivity will eventually be in that category. Yet, for some reason, despite the 1964 Civil Rights Act, we have not moved racism, classism, and other institutionalized inequities from the category of the given into the category of the intolerable. We need to ask why. Bill Foege, former director of CDC, said, quote, "The philosophy of public health is social justice," end quote. That philosophy, combined with Vickers' definition of public health, highlights the fact that above all, the prime task of public health is to continuously be the social conscience of our society. All of the other activities of public health should be in support of that mission of social justice. Addressing the political, economic, and social determinants of health is not just the right thing to do from a social justice or an ethical perspective, it is the right thing to do from a basic health perspective, because data are showing that eliminating disparities, particularly income disparities, is good for the health of everyone, from those at the top to those at the bottom. Health is not a zero-sum game. We all have a vested interest in reducing disparities and advancing equity because, as Paul Wellstone said, when everybody benefits, everybody benefits. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.